Hello guys, it's our lovely meeting, another meeting in our beloved operation theater with a brand new mystery device, which I would like you today introduce. This is the device called Diathermy, and today I will show you how it works, why we use it during the surgeries and inside the operation theaters, and why it's so convenient to have this device in your operation theater. It was invented in 1928, so quite a long time ago. Mr. Bovey invented this machine, and I will show you how it works and what we have. So, first, we have one of the elements of this device, and the second very, very important element of that device. When we talk about the unipolar diathermy, we think about two electrodes. This is, as we called, patient electrode, or earth potential electrode, or zero electrode. And that part is always under our patient or on one of the limbs. But the rule of the thumb that this part of the device has to be strictly connected with the skin or the skin surface of our patient. So that is why in veterinary medicine this type of electrode is more convenient than this one, which is single-use. It's a little bit smaller, but is dedicated for naked skin without any fur and any skin changes. So that is why in veterinary practice this electrode or this type of electrode is more convenient for our patient. So now it's time to solve the mystery how this device works. We have zero electrode under our patient, and we have second electrode in our hands. This device, called Diathermy, combines a lot of our tools which we currently have on our operation table. Because in one pen, we have cutting, so this device is able to cut. Also, in one hand, we have coagulation, so it is also we are able to have the combination of cutting and coagulation in one time. Also, guys, in that small pen, we have the ability of cutting off or destroying the tissue which is unwanted in our operation field. So how it works? As you can see, we have different endings. That end tip is dedicated for cutting. That ending is dedicated to coagulate for coagulation, and another end tip is created to destroy unwanted tissue. We have more of them. That small ball at the end tip is created to coagulate, but in smaller operation field, in smaller area, so it's dedicated for more precise surgeries. So how it works? We have our patient between two electrodes, between the zero electrode and this electrode which we have in our hand. When we press the button, we have two different buttons, and in a minute I will explain you why we have two of them. When we press the button, the buzz sound occurs. It means our diathermy works. And when we touch the tissue which we want to cut or which we want to coagulate, it will do this employing the heat wave. Because the current will pass in that field through our tissues, through our patient, but the heat is going to be generated the most here at the smallest end tip of that device. Not here, because we will burn our patient. Here the surface is really huge, so it mustn't be generated at this huge surface at the amount as it can be generated here at the end tip of our device, of our tool. This device uses the frequency from 0.5 to 1 megahertz and produces the sine wave for cutting or pulsating sine wave for coagulation, or miraculously can combine both of them. That is why it is able to cut and coagulate in one time. So this is the unipolar device. So what is the difference between bipolar device? If you have dedicated end tip, which looks like a forceps in the end, the same physical changes and the same physics will happen between these two forceps, these two branches of the forceps. So if you have one electrode here and another here and the tissue between them, so the current will pass through the tissue and the heat will be generated here at the end tip of that forceps. And this is the bipolar device. If you're gonna use bipolar device, you don't need the zero electrode. You don't need ground potential electrode because everything happens between the branches, between the parts of that forceps. But during the surgery, when really situation is very hot and you need very, very fast to stop the bleeding with precise way, always you can clamp your forceps onto the tissue. Then when you touch with the end tip of your pen to the forceps, it's going to work as a bipolar device. So you will stop the bleeding immediately. Bipolar device was created for more precise surgeries like neurosurgery or ophthalmology as well. And unipolar device was created for ordinary laparotomy, for ordinary type of surgeries, so which means the surgeries in bigger operation areas. As you can see, we have different types of that endings. Of course, each ending is dedicated for separate device. This one comes from separate case and separate device. We can direct by pressing the buttons, yellow button and blue button. We can direct if we want to cut, if we want to coagulate, or maybe we want to do both of them in one time. Also, this device has special software which you are able to choose your power, your effect, and exactly what type of cutting, coagulation, and destroy you're going to use. Also, we have another end tip which comes from that device where diathermy and bipolar diathermy is incorporated in this huge laparoscopic and endoscopic type column. And moreover, you can direct of type of cutting and coagulation with pressing of that two buttons with your leg. So everything depends what you do during the surgery and what you need during the surgery. Sometimes it is more convenient to push the buttons on the pens, and sometimes it's more convenient to use your legs. So we do everything to perform our surgeries in most safe way. And I think also about the general anesthesia time. So this device was created to decrease the time when patient is present on the table under general anesthesia, as well to fasten the recovery, post-operative recovery of our patient. So, as you can see, this miracle device called Diathermy actually combines and incorporates almost all our tools which we have on our operation table. With special endings, with our electrodes, we are able to decrease the surgery time, decrease the trauma for our patient, and also shorten the post-operative recovery time of all our patients to be safer. Thank you very much for your next meeting in our Operation Theater Planet.